Hi, everybody. I think we're ready to go. My name is Greg Rabarczyk, Associate Professor of Geography at the University of Michigan Flint. I'm the leader of the research cluster on urban sustainability and environmental health. And I'm happy to welcome Dr. Nicole Jones as our fourth seminar speaker at the university. She comes to us from Michigan State University, the College of Public Health, Human Health and Public Health at MSU, located downtown Flint. And so I'll leave the floor to Bessa to introduce Dr. Jones. Thank you.
Thank you, Greg. It is my distinct pleasure to introduce to you today Dr. Nicole Jones. Dr. Jones is an epidemiologist with over 20 years of experience on research teams for maternal and child health projects. She completed her bachelor's science at Michigan State University in zoology, psychology with a concentration in genetics. She then completed her master's in epidemiology, also at MSU, which was followed by her PhD in perinatal epidemiology. Dr. Jones leads the dynamic Flint registry staff in collaboration with broad community-based partners. As a director of the Flint registry, she strives to elevate the voices of the Flint community in the way that the Flint registry is designed, implemented, and shared with others. A lifelong resident of the Genesee County, Dr. Jones is inspired by the resiliency and the spirit of the Flint community. And with that, I'll leave the floor to Dr. Jones.
Awesome. Thank you so much, Bessa. Really appreciate the opportunity to present today. I'm going to share my slides real quickly here. Great. And thank you so much again for the opportunity. I've read a little bit about your center. It's really a great collaboration. So I really look forward to the discussion, the questions after my presentation. This work is ongoing, so I look forward to all of your feedback and ideas and potential collaborations that might evolve as part of this work. So I'm going to start out today with just an introduction to the Michigan State University Hurley Children's Hospital Pediatric Public Health Initiative, which is an initiative within the Division of Public Health here in Flint. So I'll talk a little bit about that. Then I'll give you an overview of the Flint Registry Project, which is one of our projects, and then share some preliminary outcomes from the Flint Registry work. So first, to talk more about the Pediatric Public Health Initiative, or PPHI. So PPHI is a joint venture between Michigan State University and Hurley Children's Hospital. It was officially launched in January of 2016 and is directed by Dr. Mona Hanna-Attisha, and it was created in response to the Flint water crisis. Our mission is pretty simple. Our mission is to improve outcomes for Flint kids. Our vision is through community and clinical programs, childhood health policy and advocacy, and robust evaluation that we will mitigate the impact of the Flint water crisis and serve as a national resource for best practices. We divide our work into 5 teams, which you can see here on the slide: child health and development, nutrition, exposure assessment, health informatics, that's the team the Flint Registry is part of, as well as child health policy and advocacy. And you can see at the base, the very top of this particular figure, really working on promoting evidence-based strategies. So really focused on work that's designed to implement interventions, and above all, being parent and child informed. So I'm going to talk a little bit about what being parent and child informed looks like for us. So first of all, we're lucky to have a director of community engagement and implementation. Ms. Kenyatta Doxson serves in this role for us. She's part of our leadership team. She's involved in all aspects of our work. She oversees our community partner groups, so building new partnerships and elevating existing partnerships. She's a member of our faculty and staff search committees, and really her role is to ensure that the voice of community is included in everything that we do. We also have a formal parent partners group. This group was established in 2016. We designed it in a way to include representation from all different types of parents. So moms, dads, grandparents, foster parents. We also selected representatives from every ward throughout the city. This group meets about quarterly, sometimes more often if we have things going on, and they provide input and feedback on all of our programming. We also have a group of kids that have named themselves the Flint Youth Justice League. So a really dynamic group of kids. They do all sorts of leadership development activities, also provide feedback in our programming. They're also involved in a lot of advocacy. So they've had opportunities to meet with other groups nationally and talk about how to be advocates in your community. Again, selected a wide range of ages of kids and then tried to find representation from multiple school districts. And then here's just an example of some of the programs that are part of PPHI. So I'll talk about the Flint Registry in detail. I want to point out just a couple here on the slide. State of Flint Kids is a website that's designed to look at trends in data over time in metrics related to kids' health and development. So if you're interested in finding out more data about how Flint kids are doing, I recommend checking out State of Flint Kids. Flint Lead Free is also a project that is coordinated by the Flint Registry team. It's a collaboration with many community partners looking at data related to lead elimination work in the city of Flint. So each year we add in more metrics to kind of look at it. So we produce an annual report, and that is available also on our Flint Registry website if you're interested in more data related to lead elimination activities that are ongoing in the city of Flint. And then I also want to recognize our community partners. So many of these partners are on our grants, part of our projects, and really support the work that we bring to the community. And I'd like to kind of highlight one of our programs, just kind of an example of what can happen when you really focus on advocacy as an expansion of your work. So Dr. Amy Sachs-Kustek is our nutrition director. She leads our fruit and vegetable prescription program. This program is a program where families receive a prescription for fruits and vegetables at each one of their clinic visits with their pediatrician. They can take that prescription to the Flint Farmers Market and redeem it for a bag of fruits and vegetables. And Dr. Sachs-Kustek has really tracked the redemption rates, feedback from the parents, expanded this program based on their feedback, also added additional programs such as a cooking and baking class based on feedback from participants. But ultimately, what's really nice about this program is an example of practice to policy. So because of Dr. Sachs-Kustek's work and her evaluation of the program and advocacy, this program was actually included in the US Farm Bill. It was used as a model of a nutrition prescription program that's now included in the US Farm Bill. So just an example of moving work from practice to policy. Now I want to talk about the Flint Registry, which is how I spend my time. So I serve as the director of the Flint Registry, and I like to begin with this slide, which is our logo. One of the very first things that we did when we received our funding from the CDC was to put together our parent partners group. In our very first parent partners group, we talked about the project and what the goals were and how we could implement the project. And one of our parents talked about the need for a logo and suggested that we use a logo based on the Sankofa bird, which is an African symbol. So this is the symbol of a bird that's flying forward, looking backwards, and cradling an egg in its mouth. And so it's really our vision at the Flint Registry that we are moving forward as a community together in a positive way. But we are not forgetting the lessons that we learned. We're not forgetting what caused the Flint water crisis. And as we're cradling that egg, we're thinking about our future generations and making sure that our kids are as healthy as possible. So just a timeline on our work. As you can see, we've been at it for a while. So as you may recall, officially in April of 2014, under emergency management, the source of water for the city of Flint was switched from pre-treated Detroit water to locally treated Flint River water. Unfortunately, adequate corrosion control was not included and lead leached into our drinking water. In January of 2016, an official federal emergency was declared, and as part of the Emergency Operations Center, recommendations were made as far as what kinds of support would be needed to recover from this disaster. Included in those recommendations were things like expanded access to early childhood programming, expanded access to Medicare, Medicaid, as well as a registry. And the idea of the registry was to track the long-term potential health consequences of the Flint water crisis. And when we say health, we mean physical health and mental health, as well as to create a resource to really connect people to services to make sure that we are really minimizing the impact of any lead exposure. Officially in December of 2016, Congress passed the WIN Act, which included funding for the Flint Registry. That funding went to the CDC and we applied for those funds and received them in August of 2017. So that's when our work really began. We spent a lot of time on community engagement, on building our infrastructure here in Flint, on putting together our surveys, and we officially launched in January of 2019. In between August of 2017 and January 2019, as we were collecting community feedback and building the registry, we allowed people to sign up on our website, and we called that pre-enrollment. And part of those pre-enrollees, or as part of pre-enrollment, individuals gave us feedback as well. So in there, as they were signing up, they gave us feedback on what they were concerned about, what questions we should ask in our survey related to health concerns. They gave us feedback on how we should conduct outreach. They gave us feedback on what kinds of services people were going to need access to. So we were able to incorporate that feedback as well. So our first 4 years of funding ended in August of 2021. That's what was kind of originally set aside for the work. We did receive a 1-year supplemental grant. So we're currently in our 5th year. Our funding is currently up at the end of July, but we'll be applying this spring for longer term funding to support work for the next 5 years. But our vision is that this is going to be long-term work, that we will continue to make sure that people are getting connected to services and resources. So we're a public health registry. We're not a research registry. That means our goal is to support the health of the community. We do that in 2 ways. One is, again, by asking people to complete a survey so we understand what the health concerns are and what resources are needed. And then second is we have a very structured referral process where we refer people to services and service providers follow up with individuals and enroll them in programs. It's a community level intervention. So anyone who is potentially exposed is eligible to participate and was designed specifically in response to the Flint water crisis. Our goals are to identify exposed individuals. So we do this in 3 primary ways. First of all, through marketing locally. So bus ads, billboards, commercials, radio ads, social media. We also have an outreach team, a very extensive outreach team, which not only includes MSU team members, but also local community agencies that are doing outreach for their programs as well. All of that outreach is coordinated by Greater Flint Health Coalition. They also coordinate our community referral network as well. And then the third way that we're trying to identify potentially exposed individuals is through a more population-based approach. So looking for lists of individuals that are potentially exposed and sending out mailings. So one real easy one is current residents of Flint. Another list of individuals that we've mailed to are individuals that were enrolled in Michigan Department of Health and Human Services programs during the time of the water switch, linking to their current address. So even if they've moved out of the area, we can still kind of reach out to them and tell them about the registry. Our second goal is to connect people to resources. So I'll talk to you more about how we do that through our referral program. To reduce ongoing exposure to lead. So I told you a little bit about our Flint lead-free work. We also make sure to make services or referrals to programs that are targeted to reducing exposure to lead. So long-term to monitor health and child development. So we have a 1-year follow-up survey right now, and we're planning to do future waves of surveys. And then of course, to share what we learn with others. The outcomes that we expect to see is that our participants will demonstrate an increase in utilization of services. Individuals will over the long time have improvements in their health and child development. Our goal is to be able to report on how impacted families are doing overall on health and child development measures and compare those to other communities as well. We're constantly looking to identify gaps in resources and to advocate and implement additional resources. To be eligible for the Flint Registry, it's open to anybody who lived, worked, went to school or daycare at an address serviced by the Flint water system from April 25th, 2014 to October 15th, 2015. These are the official eligibility criteria that were set by the CDC as part of our funding. So the dates were selected by the CDC because that was a period of special concern as far as exposure. So specifically with the Flint Registry, recognizing that the Flint water crisis was sort of an example of resident voice being suppressed and not being listened to, we really recognize the importance of including community voice at every step of the way. So I've talked to you about the 3 ways that PPHI includes community voice, and then there are some specific additional ways that we've done it throughout the registry. So we also have a registry-specific community advisory board. On that advisory board, we've identified specific segments of the community that we want represented. So for example, we have a representative from the education community, from the faith community, from the labor community, from the medical community. So each sort of area, it's made up of people who live, work, and serve in the Flint area that are kind of leaders in those areas to bring voice to our work. We also conducted 2 rounds of focus groups. So about that summer when we were planning before we launched, we had our first round just to give a more diverse group of people an opportunity to give us feedback. We did a round of focus groups really focused on what the Flint Registry should be about, what services should we connect to, what resources. And then a second round about a year after we launched to really focus on how should we market the Flint Registry? What should our outreach strategy look like? What things can we do to improve the process? So we are constantly receiving feedback. I've listed local presentation and events because we constantly are out in the community receiving feedback. We also have a registry ambassador training program, again, led by Greater Flint Health Coalition, where individuals receive training on the Flint Registry and go out in the community and share the word. So that's one of the main reasons or ways that people hear about the Flint Registry is by word of mouth. And then finally, we applied for and received approval from our local community ethics review board. So as we're in year 5, this is the work that we are working on right now. We're doing active and targeted marketing and outreach. And as we move forward, things will become more targeted. And so I'll talk to you in just a second about the list of people that we're really trying to go after, which is our high risk individuals. We're continuing to do those surveys in our 1-year follow-up survey. We're moving into a phase where we're trying to really maintain the cohort of individuals. So making sure we're doing ongoing communication and also providing people with opportunities to update their contact information if they might be moving, and then always evaluating our work and disseminating our findings. So these are the high-risk groups that we're really spending more resources on trying to enroll in the registry. So with regards to kids that were 0 to 6 at the time of the water switch, we have some additional funding through a grant that we received from the Genesee County Health Department as part of their Healthy Start expansion that they received funding through HRSA from. So our goal is to enroll at least 25% of those kids, and we've been able to enroll 33% of the estimated denominator of kids that were 0 to 6 during the water switch. We're also spending extra time and resources on kids that had blood levels at greater than 5. And we are again partnering with Greater Flint Health Coalition, who leads our county EBLL program, to spend extra time on recording those particular families. We also have used data from flintpipemap.org to take a look at households that had either lead service lines or galvanized service lines, and doing additional mailings to those households with the hope of really making sure that those families enrolled. And then finally, we're working on a lead and water risk score to understand more about address history and how that might predict someone's potential exposure to lead. So the way the Flint Registry works is people at enrollment do their eligibility and consent. We have that baseline enrollment, that baseline survey. We ask about health, child development, and utilization of services. We then make referrals. If individuals give us permission, we can link their survey data and their referral data to outcome data like the Michigan Department of Health and Human Services Medicaid database if we've gotten consent. And then we're, as I said, doing 1-year survey follow-up, which also includes referrals, and then long-term continuation of follow-up with the cohort. So just some groups I like to thank. When I talk about our extensive outreach strategy that's coordinated by Greater Flint Health Coalition, these are all the organizations that they have collaborated with to do outreach activities in the community. And then also, these are the organizations that have agreed to receive referrals from the Flint Registry, which means when we make a referral, they've agreed to be part of our network, that we have a software tool that we all use together. They receive those referrals, they check them on a daily basis, they follow up with those individuals, and then they go back into the software and give us the outcomes of the referrals. So we get some feedback on whether the referrals that we made are actually connecting people to services. So this is kind of now a little bit of the data, just kind of giving you an idea of what it looks like. So we started out with all those pre-enrollee sign up people and kind of our community outreach strategy. We then shifted to our community-wide mailings at the end of 2019. Things really picked up for us at that point. And then we shifted on to slowing down a little bit with COVID and transitioning to be a remote workforce. So our goal is to get to 20,000 individuals. At the end of 4 years, we were at 16,000. About halfway through our 5th year, we're closer to 19,000. So our goal is to finish up the preliminary 20,000 by the end of the year, at the end of the grant year. But as I said, or I may not have mentioned, our plan is to always leave enrollment open for folks as long as we have funding. So enrollment will not close, people can sign up, but we will do things like our 1-year survey, we will wrap that up. So we'll leave enrollment open, but follow-up survey waves will close. About 1/3 of the enrollees in the registry are children. That means adults are completing surveys about their kids. About 2/3 are adults. Our youngest participant was 2 years old at enrollment, and our oldest was 104. We have a multimodal method of enrollment. We tried to keep it real flexible for folks. So really offering lots of different ways for them to complete their surveys. We're not doing in-person right now because of COVID restrictions, but you'll see that the majority of people prefer to do their surveys online, but there are a large amount of people who prefer to have the survey read out loud to them over the phone. We also are kind of tracking how we're doing with regards to representation of the city of Flint. This is again where people live at the time of enrollment. And you can see that we have a little bit lower enrollment on the east side. So we're thinking about what kind of outreach can we do on the east side of Flint to really up those numbers. And then where people live. So interestingly, 2% of individuals are no longer living in the state of Michigan, but still heard about the Flint registry and were able to enroll. 4% are still in Michigan, but no longer in Genesee County. 11% are in Genesee County, but not living in Flint when they enroll, and 83% are living in the Flint area when they enroll in the registry. So with regards to referrals, we decided to focus on 4 key areas: lead exposure, health, child development, and nutrition. And when we say health, we mean physical health, mental health, dental health, health insurance, as well as programs for seniors. So just a little bit of data of what we're seeing as far as need when we're making referrals. So our number 1 category referral is lead elimination programs. Our second category is health, third being nutrition. And as you know, we have a smaller population of kids, so child development is our 4th category of referral. People can opt out of, so when they do their consent, they have some options. They don't have to do referrals if they don't want to. Less than 10% of people say, I don't want referrals, I'll just be part of the registry. About 2/3 of individuals get at least 1 referral. That means that people may not qualify for referrals. They're not receiving referrals if they don't qualify for any of the services that we were making referrals to. And of those individuals that receive referrals, they're receiving around 2 referrals, but we have some family members who may have received up to like 12 referrals to services. Just to kind of tell you like a little bit more detail, top 5 for adults referrals. We made a lot of referrals to the Fast Start pipe replacement program in the city of Flint. People wanted more information about the program. They wanted to opt into the program and needed some help. And the city of Flint followed up, and it was a great partnership for both us and the city of Flint getting people connected to that program. The second group of referrals that is most common for adults is the Genesee Health System Access Center, that's mental health services. So that means either when they completed some of the mental health screeners on the survey, we felt that they would benefit from maybe mental health services, or they're requesting a referral to mental health services. And then the third kind of big category of referrals for us, all 3 of these are related to nutrition assistance, food assistance programs. So this group right here, this 1,800, those are referrals for families to get emergency food assistance. So based on how they completed their survey, we thought they would benefit from emergency food assistance. The other 2 programs are longer term food support. For kids, things look a little differently. You can see that we have this really big chunk of group of referrals that we make to the Neurodevelopmental Center of Excellence, or NCE. We make a referral where kids can go for a complete neuropsychological assessment. We make a referral to NCE based on, again, the survey or parents' request. The Lead Safe Home program is our second big group of referrals for kids, really focused on getting lead out of their home environment. And then rounding out the top 5 are referrals for things like access to Medicaid, support for kids who may have had an elevated blood lead level, or dental services for kids. Just giving you some really broad, just sort of health metrics here. Again, we have a lot of questions about specific conditions or symptoms that people might be experiencing. A lot of the data that I'm sharing is actually available in our website on our inaugural report that we just recently put out. But when we ask adults about their physical health and their mental health, you can see almost 40% of adults are saying they have fair or poor physical health, and a similar percentage for mental health concerns. This is really the big need that we're seeing right here when we ask about within the past 12 months, were you worried that your food would run out before you got more money to buy food? 40% of our adults are saying yes, they have that sort of financial worry about being able to afford food for their family. And then when we ask about access to fresh fruits and vegetables in their neighborhood, right here, this is about a quarter of people who are saying they disagree or strongly disagree that they have access to fresh fruits and vegetables in their neighborhood. Just one little quick slide, just kind of, again, with some different mental health questions, but looking at perceived stress or pressure that people are feeling on a daily basis. The blue indicates sort of the summary for the adults in the Flint registry. The orange is national norms. So looking at our adults and the stress that they are facing on a daily basis, they're reporting much higher levels of stress. And you can see that younger adults are reporting the highest level of stress. Again, looking at financial security for our families, when we ask them how often is it very hard to cover basics like food and housing, for the rarely never right here, that's just over 50% of our samples say that it is rarely or never very hard. 11% are saying it's very often very hard, and 35% are saying it's somewhat often very hard to cover basics like food and housing. And again, looking at being able to afford enough food, only about a third of our samples says we can always afford to eat good, nutritious meals. Half of our sample is saying we can afford to eat enough to eat, but it's not the kinds of food that we would like to eat. And then we have a smaller percentage that are saying often or sometimes we cannot afford enough to eat. And then just a few measures on child health. For child physical health, you'll see it's about 10% of parents are reporting that they have concerns about their child's physical health being fair or poor. And a greater percentage of parents are reporting that they have concerns about their child's mental health being fair or poor. And then this is just an example of one of the sort of standardized assessments that parents complete. It's nationally normed. It allows us to kind of break down behavior into 4 different domains: externalizing problems, internalizing problems, behavioral symptoms, and adaptive skills. So when kids score in an at-risk or clinically significant range on this particular instrument, we would then send them off for a further assessment or to see if there's a diagnosis of concern that they might need support with. You'll see this line right here. So based on sort of the norms of the instrument and the way that it's put together, we expect about 15% of kids to score in this particular range. You can see that we have much higher levels of kids that are scoring in the at-risk or clinically significant. It's also broken down into 3 different age groups, so preschool, school-aged, and adolescent, as well as 2 different genders, female and male. You can see kind of across the board, the group that's doing the best are preschool girls. They're the ones that are doing the best. The biggest sort of behavioral concerns are related to adaptive skills, dealing with stressors. And then I'd just like to share finally a little bit of information about the Neurodevelopmental Center of Excellence, or NCE. I often say this is like one of my favorite things that came to Flint as part of the Flint water crisis. The reason I say that is because we were having a parent partner meeting and we did an icebreaker question, and we asked our parents, if you could wish for one thing for your kids, what would you wish for? So our parents wished for lots of things. They didn't ask for trips to Disney World. They asked for after school programming for their kids. They asked for in-class assistants that were going to be sympathetic and empathetic to kids that needed extra support. They worried about transportation to after school programming. But one of our parents said, I just wish there was a place I could take my kids and really have them assessed and know that they're going to be okay, or know what we need to work on. So our parents are really, they're very traumatized and they're very concerned about the lead exposure, and they really want to know what they need to work on with their kids. So we didn't know that at the time when the parent made that wish, but it literally happened. A center was created as part of a sort of a settlement with funds from the state at Genesee Health System. It's called the Neurodevelopmental Center of Excellence. It opened in October of 2018. It provides a complete neuropsychological assessment. I'm going to say it's a great asset, but it's also a great challenge. It's a great challenge to get families to be able to go through the whole process because it's extremely lengthy. We make referrals to NCE if kids score high on those standardized assessments. So the BASC helps us understand behavioral health. The brief takes a look at executive function, again, looking at parent-reported behaviors. Kids could also respond yes to a certain number of critical items, then we would make a referral, or parents can just request. On the survey, they can say, yeah, I want a referral to the NCE. Interestingly, we're finding a big overlap between the parents that have concerns and the scores on these standardized assessments. They're very similar, the same group of kids are identified. So just again, some outcomes from the NCE based on the first 174 kids that went through. We're doing a deeper dive in some of the data now, but just a brief summary. 88% of these kids needed school supports or interventions, received recommendations. 80% received recommendations for behavioral or mental health treatment, and 79% received recommendations for medically related follow-up. So again, remember, this isn't representative of how kids are doing in Flint, because we're referring the most high-risk kids to the NCE, and we're not the only place that's making referrals to the NCE. So teachers, educators, clinicians, or parents, anyone can make a referral to the NCE. We just happen to be the biggest source of referrals in the community. And then what we're up to next. So we're going to continue again to leave enrollment open. We continue to do more focus on targeted recruitment on high-risk groups. We're really working hard on making sure we maintain this cohort, that we stay in contact with people. We're finishing up that one-year survey, so we're going to close that out, and we'll plan to do a future survey waves either targeted to specific groups. So for example, maybe like an adolescent survey, as well as a large survey of everyone, again, to see how they're doing and continue to make referrals, and always evaluating our work and disseminating as well. And that is all I wanted to share today. So I'm happy to take any questions.
Thanks, Dr. Jones. That was fantastic. So if you have questions, I think you can raise your hand, or you can put them in the chat, and I will help facilitate that.
Okay, I'm going to ask the question just to kind of break the ice a little bit. Hopefully I can inspire others to ask questions. First of all, thank you for the wonderful talk. It's interesting to see the connections with the community. I have worked closely with the Flint Development Center and the Mackenzie Patrice Water Lab, and I was wondering if you are working with them as well, because they are testing drinking water for copper and lead, and they are helping those residents that test high to refer them. Now, I don't know if the extent of the referrals is what your project is doing. So I think that might be interesting to perhaps connect with them, and I'll be happy to facilitate that.
Yeah, thanks. That would be fantastic. I am not particularly working with that organization. I don't know if anybody else in our particular unit is, but I'm not particularly. So that would be great. Thank you so much.
Yeah, I have one more question actually. With the parent focused focusing groups, how do you go about it? Is it certain anchor parents that you're working with, and then they are spreading the word, or is it just a focus group that you're just getting data out of?
Yeah, so we had two different things, our parent partners, and then a separate round of focus groups that were focused on like key sectors again of the Flint community. So for example, we did a focus group trying to really recruit and enroll the Hispanic community to really understand what their perspective was. So the parent partners group, what we did do actually when we initially created it, and has worked out really well, is we picked parents that were serving on other community groups as well. So they're already active and engaged, and we created kind of this network. So for example, Genesee County Health Department also has a parent group, and one of the members from that group is on our team. So as far as like being able to share information across this network of parents that's really engaged in the community, I don't think we anticipated it was going to work that way, but that's how it's worked for us. So our parents are people that are sort of already actively engaged in the community and connected to other groups, and it's really worked well for us.
Thank you.
Yep.
I have a question. I'm curious, I lived in Flint before the crisis and during the crisis. And so I'm curious to know if some of these poor outcomes, like adaptive skills amongst children, how much of it has been attributed to the water crisis? I mean, my anecdotal evidence tells me that the residents of Flint are weathered. I think it was Dr. Sadler who's coined that term, the weathering of residents in these legacy cities like Flint. So I'm just curious if you have any information on these outcomes being directly linked to the water crisis, or has it just been, since GM left Flint, that these outcomes, low access to healthy foods and student learning outcomes, have they been compromised even further because of the water crisis? Has there been a direct link?
Question. As you kind of saw from my presentation, our eligibility criteria are just to make the assumption that everybody was exposed, everybody's potentially, eligible, and get us to where we're at. As part of the registry, we don't really focus as much on causality as much as this is where people are at right now, and these are the resources that are needed. But within our group, there are specific projects that are more focused on understanding the exposure. So for example, we are, as part of consent, people can choose whether they want to be contacted about other projects. So there's a project that we're doing called Flint Tooth Fairy, and that is asking parents to provide shed baby teeth, and looking more specifically in teeth to understand lead exposure, and also doing behavioral assessments on kids. So that's a more specific project that's spun off from the registry. Really look like you're saying, to try to understand. I think we recognize that this is just one of many traumas that Flint kids experience on a daily basis. And so we don't try real hard to tease it out. That's not really our role. Yeah.
Thanks for that answer. Can I ask you a follow-up question?
Yeah.
Regarding the Flint registry itself, how easy is it to get registered? What I'm thinking about is the technology gap that most disenfranchised persons face. And so is there a way to minimize that technology marginalization regarding people getting registered and becoming part of that project?
Yeah, so that's why we kind of tried to set it up in a multimodal way so that people can just do it completely over the phone if they would like. People can sign up at our website and get like an email or text sent to them right away to do their survey if they prefer. So there's kind of like a range of options. An interesting kind of anecdotal story, as well as I'm part of the team that's evaluating the impact of the Flint Medicaid waiver expansion. So there's an expansion of access to Medicaid based on both age and income requirements in the city of Flint for individuals exposed to Flint water. They're evaluating the impact of that, which is very difficult. But one of the things that they're doing is sending surveys to individuals to ask just about services that they've received. And when they first designed it, they were kind of thinking like, I think we should really make this more of a mail-based or telephone-based survey. They went to our parent partners meeting and talked about it, and the lady was one of our parents was like, you really just need to send it to us on our phone. So there is a technology gap, but there is also a large sector of our community who is really, really tech savvy as well. Yeah.
I have one more. This is turning into a conversation. What about the fear of government? There's been a lot of research on how, especially residents of Flint, are just fearful of government, fearful of academics. So have you faced challenges in that regard?
Yeah, so when we first started, again, in the first years when we talked about the registry to people, that data security and confidentiality always came up as one of the very first questions. Why do you need my data? What are you going to do with it? Who's going to have access to it? That was always a theme at every meeting. So when we designed our IT structure of how we were going to do things, we brought it to our parents and we said, what do you think about this? Does this look good to you? But what's also really interesting is it's almost like a trend that you'll see at a meeting. We'll start out, we'll talk about data security and confidentiality. We'll share information about our IT partners and what we're doing to keep things safe, and how we have a consent process so people can decide like, oh, I don't want my name to go to referrals, or I don't want this part to happen. So we talk about what we have in place. And then by the end of the meeting, as we talk more about the registry, people start giving us feedback on where we need to do outreach. You need to really share this program with other people. So it is a big concern for folks, and we've done our best to address it, but yeah, it does come up. Yep.
There's also one question I think I can see from the chat. Lisa is asking, what is the percentage of seniors benefiting from this registry?
That's a great question, Lisa. I cannot think of off the top of my head what percentage of our adults are over 60. I apologize. But we absolutely focus on referrals for senior programs. So we refer to VAAA as one of our hubs. But that is a great question, and I can't remember it off the top of my head.
So I have one more question. Would there be any interest into looking at maternal blood exposure when you're, for example, testing the saliva of the children that are being evaluated for behavioral or psychological aspects? Because Dr. Dana Dolinoy, we had her invited, we were talking together about her. She is able to test saliva for markers, potential markers that could indicate maternal lead exposure. And I think that will lead to, I think, a really promising collaboration where you don't even have to take blood. They just, you take the saliva, and that will kind of give you an indication if they've been involved, and perhaps a relationship between that and behavioral or neurological or other types of disorders.
Yeah, so we've really tried to set up an infrastructure so that the registry can be used for other things. Like I said, we've asked people whether they consent to be contacted about other projects. And so we try to design it in a way so that if people have other questions that they want to ask, that we kind of have this cohort, we have detailed measures on them in certain areas already. And if you have certain eligibility criteria, it's easy to kind of filter down to, okay, this is the group of individuals that I want to work with as a resource. So yeah, that's a great potential follow-up project as well.
Yeah. Wow. Thank you again.
Yeah. Excellent.
Dr. Jones, this says one more, building on Bess's question, how can the research cluster, or UM-Flint for that matter, get involved? I know that I see Dr. Jan Furman in the audience, virtual audience, and I know for sure she's interested in this topic. She's interested in collaborations and, of course, helping help the city of Flint. So how can members of the UM-Flint community help?
That's a great question. Help as in get people connected to the registry, or help as in other projects that you might be interested in, like joining with the registry on? Is that what you're thinking?
I will say all the above, but
all the above.
Yeah.
So we do have a process for requests for just kind of, if you want to recruit from the registry for particular projects, we have a formal process, and you just reach out and say, hey, this is my project, it's IRB approved. this is, I recommend doing that before you get your funding would be good, or before you, just to make sure that it kind of goes through the registry leadership team. And again, it has kind of community voice as far as review. But we do have a process, yeah, if people are interested. We haven't done it. We've done with a community organization, and we've done it with an MSU investigator. As you can see, we're still kind of collecting data. We haven't done it with another academic institution, but hey, there's always a first. So if you're interested in, I'd say if you're interested in that, or if you're even interested in learning more about the data, if there's specific questions that you're interested in learning more about, please feel free to reach out to me. Yeah.
Okay. Yeah, I was going to ask if there's a link to a form or email, but if you don't mind getting your email clogged up by Flint people, then we're going to do that.
No, because I'll clog yours right back up as well.
Touche, touche. Do we have any other questions? Well, I think we'll end early. I mean, on behalf of Flint and the research cluster, Dr. Jones, we were delighted to hear you and invite you and listen to you talk about the Flint registry. And
Awesome.
hopefully we'll be in contact more.
Yeah, thank you. It was really great to learn about your center as well.
Thank you so much.
Yep. Bye.
Thank you so much, everyone, for joining us. Have a good weekend.